Okay. Actually, we're gonna have Anthony Ward introduce himself, if you don't mind going first.
No problem. Can everybody hear me? Can I get a thumbs up? Okay. All right. So I'm Anthony Ward. I am a licensed clinical professional counselor in the state of Illinois. And I am 2006 psychology. I was pre-med. I did not complete my pre-med afterwards, but yeah. I don't know. Do you want me to pass it on to somebody else?
Yes. Is it Ladi or Lal?
Yeah, Lal Puri, how are you, Dr. Puri? I am a practicing orthopedic surgeon. I'm actually tremendously purple. I did my undergraduate there, and then I went to medical school. I graduated in '95, and then I was on staff at Northwestern for the first 11 years of my career, and now I actually practice right up the street from you guys at the North Shore Orthopedic Institute. Although I graduated quite a while ago, I still think I might have some tips and tricks and some advice for you guys. So it's a pleasure to be here today.
Thank
And
you.
as a side note, my senior is moving in today. I forgot today was moved back to campus day. So I have one almost ready to graduate as well. So welcome back to campus, guys.
Thank you. And then Dr. Haley Silver, if you want to introduce yourself.
Sure. Hi, everyone. Similarly, I am maybe not quite as purple, but pretty purple. I did medical school at Northwestern, and I trained in New York, but then came back and was on staff at Northwestern for 3 years. I'm a urologist. I specialize mostly in benign non-cancerous urology, but I do some cancer surgery as well. And about a year ago, joined the North Shore group. And so now I too practice now very close to your campus. And I am very excited to be here.
Thank you all so much. So the way we're going to run this is we have pre-prepared questions for all of our panelists that I will be asking. And then if anybody has any specific questions that they want asked, they can send it to Andrea, and then we will try to get to them before we leave today. So I think we'll start in the order that we introduced ourselves. Our first question we have is, what were some impactful classes or experience that you guys had in school that led you to consider and eventually pursue your chosen industry?
Sure thing. So impactful classes, I think one is psychology 101. So for me, I've always had an interesting experience growing up. I was always like a part of a lot of different groups, but like not a member, but not part, meaning like so many people allowed me to be in the group. So I played sports. I played sports at Northwestern, played football. And I was always thinking about how relationships work and how things work. And when I took Psychology 101, I felt like I was given words for what I was experiencing throughout my life. So that was one. Another thing was African American literature class. So for me, I never liked reading because, or not reading the books that were given to us. So as a African American, most of the books were not of my culture. So when I took an African American studies or African American literature class, that allowed me to like hear minds and ideas of those that were similar to who I was, and that really impacted me to read more, understand myself more. I think one of the most impactful experiences, though, for me was actually, I call it like the arena of the cafeteria. So to me, in the cafeterias where I felt like we had so many big, deep conversations about the world and what was going on around us. So we had all the things we would learn in books, but then when we were coming to the cafeteria, it gave us a chance to really like play out our ideas on each other and talk through things. So for me, that cafeteria experience is where I felt like I had a lot of deep, meaningful conversations that I really missed once I got out to the quote unquote real world, because it didn't, at least in my experience, growing up on the south side of Chicago, like people didn't have these big higher level thoughts. And so I think those were the experiences where I got to rub shoulders and elbows with people who thought differently than me, were in different majors than I was in. So I would literally spend 2 to 3 hours waiting for different waves of people to come through the cafeteria just to talk about different things that we were thinking about. But yeah, so I would think that'd be it. Dr. Puri, I think you're next.
Thanks, Anthony. That was a great answer. I don't know if I can follow that. One thing I will say, going through the pre-med grind, and it is absolutely a grind. I would imagine that a number of you will go through organic chemistry, physics, biology, regular chemistry, and not be particularly inspired by some of these classes. And my advice to you is that if you truly want to get through it and become a physician, it's sort of these 2 years that are a real grind, and they won't necessarily inspire you. But your third and fourth years, I was actually a neurobiology major, and it was only until my third year that I started to take classes that I actually enjoyed, and they started to delve past some of the sort of the weed out concepts that you're forced to memorize, to show that you can handle some of the information that you're going to be thrown in medical school. So my advice is don't get discouraged by some of the the rote memorization and some of the things that frankly might not inspire you when you think about what you're going to be doing for the rest of your life. So undergrad is nothing like anything you'll do in med school. And even in med school, the first couple of years, at least through traditional med schools, you're going to be stuck memorizing things and you're going to ask yourself, what am I doing here? And it's only until later in medical school where you actually start to put your hands on patients and start to make a difference in their lives that I think you'll start to feel that you're getting something out of this. So don't give up.
I definitely agree with what both have said before me. I too was a neuroscience major, and I really wanted to pick a major that would allow me a smaller community academically. I went to a Big Ten school for undergrad. There were hundreds of people who were pre-med when we first all started out as freshmen. And I wanted to do something that was still in the sciences, but would make the school feel smaller and also give me access to a lot of different electives that, especially in the third and fourth year of undergrad, that I wouldn't have had access to. I will say it's your last opportunity to be in school and learn something other than science and medicine. And I actually really cherished my non-science classes a lot for that reason. So I took a logic class, I took English class, all sorts of music classes, history, music. I mean, it's your time to really just have fun with your education. There's always time to do the required coursework. I will say that one experience in particular that was very helpful for me was getting involved in research as an undergrad. So I worked in a traditional basic science, neuroscience lab my first 2 years of undergrad. And then the second 2 years, I was in a cognitive neuroscience, functional MRI type of lab, totally different. But being exposed to that during undergrad allowed me to not only have an appreciation for the scientific method in real life, but learning how to read papers, starting that process in undergrad was very helpful for when I got to medical school. It didn't feel as overwhelming to me. It also helped affirm that I liked it. I mean, I don't like all of it, but that it was something that interested me, because whether or not you do basic science or clinical research, you still have to read about it. And if you don't enjoy reading about it, it's going to be hard to keep up with that when you have to read about it. I've obviously chosen to stay in academic medicine, like Dr. Puri, and there is certainly various ways that we can be academic without writing papers. Teaching is a big piece of that, but you have to like it to some degree. You have to like learning and reading, and it has to be stimulating. But with that said, the real aspects of how I chose my specialty came way later in medical school. And that's kind of its own separate answer I can give later. But I think that it's really hard to really envision a life in medicine until you are really in the hospital and exposed to patients and exposed to that environment. And I know sometimes those options are limited in volunteer work these days. So.
Yeah, thank you for that. Our next question then, Can you tell us about your first job in each of your respective fields and kind of what it was like and if it was what you were expecting or looking for?
All right, so I'll jump in there again. My first job out of undergrad in psychology was at a therapeutic day school. So a therapeutic day school is a place where we have young people who have emotional and behavioral challenges. It was definitely a shocker to me. So, I was in like going to Northwestern, we are on like this special track. Like we kind of go above the fray of like the general population in high school. And so then to be in a high school where it's like the tier that you don't get to see of people who've just struggled and been through a lot of things. There was a lot of trauma there. It was challenging. So, I started off at a therapeutic day school as a behavioral interventionist freshman year for freshmen. And I was just challenged to know, like, what is all these theories that I had in my head? Can I use any of them? It challenged me to want to go back to get my master's in clinical psychology. But it was not what I expected. I just didn't know what I expected. You kind of come out of Northwestern thinking that you're going to change the world, save the world. And then you get faced with like real life problems and you're like, I don't think I have what it takes. I think it does challenge you to go back to the drawing board, re-envision yourself, re-envision what you have experienced, and then reskill yourself, retool yourself, and then you'll go back towards those challenges. So I think my experience was just like, this is tough. I don't know if I like it. I don't know if I can deal with it. And then after a while, you find that you're capable and able to do things that you weren't first able to do. And then you're still challenged to grow and change. And I think that that's kind of what my experience was.
So, my first job, and, after you finish all of this training, and particularly when you go to a Northwestern undergrad and you have a little bit of a sheltered life and you train in wonderful places, you expect from yourself nothing but the best. And the first job that I took, I was hell-bent on being on the East Coast where I'm from originally. And I took a job outside of Philadelphia, more so for location. My family's all out there, more so for location than the actual job. And it turned out, for a whole host of reasons, I absolutely hated my first job. And it was really mentally challenging because I had, at that point now, after undergrad, so after finishing what you guys are going through now, which is definitely a grind, pre-med, I did another 4 + 6, 10 years of training after I finished undergrad to get to this point. And I would have expected that I would have picked something great and I would have been pretty much set. But that's not the way the world works. And so I would say, overcoming adversity and understanding that you still have agency in some of the decisions that you make. But even going to a place like Northwestern for undergraduate, and whether some of you end up there for medical school, or I'm sure a whole host of other medical schools, it's a little bit of luck, it's a little bit of perseverance, and there's no linear path to success. It takes time, it takes the ability to overcome, I wouldn't even say bad decisions, but just overcome adversity. And sometimes I think at a place like Northwestern, we're maybe a little bit more sheltered than the real world, and that's okay, as long as you realize that you are going to encounter some situations that you didn't expect, and that's just part of the deal. So that's the one piece of advice, is that even though going to medical school and becoming a physician is a linear path, it's not always that linear, and be ready for some bumps in the road.
It's definitely well said. I will say my path was certainly not what I expected it to be. It took turns at multiple times. For those of you, I realize I said that I'm a urologist. I didn't even know what a urologist was even when I started medical school. So I should also clarify, what do I do for a living? So I'm a surgeon that deals with the urinary system. So I deal with surgical problems of the kidneys, the bladder, and the male reproductive organs. As many of you then can safely assume, there aren't that many women who go into urology. It's getting better, but a board certified urologist, it's about 9 to 10% of us are women. And even smaller, those of us who are urologists who don't specialize in female issues. So I treat mostly men. When I was in training, I made a choice to start a family, which was not super popular. And I was the first female trainee to have a kid in my program. And that was a very challenging wall to break down. That sort of changed my path a bit, where I thought I was going to do additional training even after my residency, but I ended up being offered a job at Northwestern to come back. I'm from Chicago as well. So I opted to take the job and start my career at Northwestern, thinking it was actually maybe my dream job. And I never would have thought I would have left Northwestern, and it was a great place to start my career. But there are a lot of things about starting practice that nobody trained me to understand. Anything from billing and business management in medicine, how to build a practice and market yourself. I mean, it's a very different world. You spend so many years, decades in school and in training, and you come out in your 30s or sometimes older, having never had a real job. So there's a lot of learning that happens on the job. There was a statistic that somebody told me that in medicine, at least 50% of people leave their first job. That's a pretty high statistic. It's also very expensive to onboard new physicians to hospitals. So from a business standpoint, it's a pretty bad number. There's a reason, though. I think a lot of us don't really know what we're getting into, even when you think you do. With that said, the mindset of rolling with kind of the punches and rolling with the twists and turns, and not being so narrowly focused that you lose sight of opportunities that might present themselves and lead you in a direction you didn't anticipate. That was really hard, but a real life lesson that I learned. But also to be flexible. I think that we all think that we know exactly what we want to do with our life, and life has a way of changing. And so knowing that it doesn't have to be only one medical school you want to get into, and only one training program, and only one specialty, and only one city, and there might be a lot of other options and possibilities. And I think being open-minded is really important.
Thank you for that. You guys brought up a lot of great points. I think a lot of students don't realize or tend to overlook as we're going through our undergrad years. But I know, Dr. Silver, you talked about your field a little bit already, but if everybody else can kind of tell us what your day-to-day looks like for your job, what's your main focus, a little bit more details.
Sure thing. So I kind of do everything. So in the nonprofit world, I'm a clinical services manager and trainer. So I do a lot of, I meet with clinicians, have interns, I help them kind of understand psychology, the use of psychology, and how they can meet the needs of their clients. I also have private practice where I meet with clients across the lifespan. So youngest age 4 up to like 70, and you helping the clients with different presenting problems, whether it's ADHD, complex grief, trying to think of some things, drug-related issues, conduct disorders, stuff like that. And then I also do some consulting with a early childhood education center where I would do mental health assessments and help with like their kind of like social emotional component to implementing that in their school. So I kind of do a little bit of everything when it comes to the mental health field. And that's, sun up to sundown. So 9 to 5 is the nonprofit world. Private practice is more of the evenings, and then, kind of moonlighting as the consultant for the early childhood education center. And, it looks like doing paperwork, which is the bane of our existence in the health field. Like, so you gotta, in order to get paid by insurance companies, you gotta do this whole billing thing. You gotta write stuff down so people know that you did what you said you did. That's the thing that's most uncomfortable for all of us. I don't know if anybody else would agree with that, but for me, I don't like it. But meet with clients, talk with clients, finding inventive ways, creative ways of using, the tools that are available to me to help somebody, experience hope, see themselves in different ways, and kind of grow and change. And that's the thing I do day to day.
Anthony, I'll double down on the paperwork and how much we hate it. So I agree with you. So what I do, again, I think Kelly's point was well taken. She introduced herself as a urologist. I knew exactly what that was, but many of you didn't. And the same thing that goes for me. So what I am is an orthopedic surgeon, and within orthopedics, there are many subspecialties. You can specialize in pediatric orthopedics or spine or hand or shoulder or elbow. What I do in orthopedics is I replace arthritic hips and knees. So I do artificial hips and knee surgery in patients who need them. And I had to do an extra year of training after residency. So that was 6 years after medical school, or a total of 10 years after undergraduate. And what I do is 2 days a week, I'm in the office seeing patients who are in pain. They come in, they have a painful hip or a painful knee, and then we talk about surgery. And then 2 days a week, I'm in the operating room all day. And then the third day, I do a lot of administrative things for my department. And then I also, twice a year, I do a mission trip where we go to a country that's in need, and we do joint replacement surgery for free for patients who are in need. So that means we've been to Vietnam, Nepal, China, India, Brazil, and I've been doing this about 20 years. I've been on 17 trips. So that's a tremendously rewarding part of my year, and something that breaks up the routine of things. And I think that's real important because you can get burnt out pretty quickly no matter what you pick. And then the other thing I do on the side is I do consulting for medical device companies. So what's new on the horizon? So I help develop new techniques and new instruments for newer procedures. So that's also something that's intellectually stimulating, that takes you out of the patient care arena and really adds to a layered life. So that's sort of my week in a nutshell.
I mean, I'll just say really quickly, my weekly setup is very similar to Dr. Puri. I spend half my time in the operating room and half my time seeing patients in the office. I teach, I train residents who are already decided on becoming urologists. I have been involved in the Alumni Association for the medical school now for a number of years. I speak on panels like this, especially to high school students, local high school students, and do a lot of community volunteer work with my husband and our family. So.
Thank you for those. Our next question, what are some trends you see in your profession, whether related to the pandemic or not? Is there anything that sticks out to you that you think is worth noting?
So the trend in mental health is the fact that we can do telehealth services. I think that when nobody can get outside the house, we kind of did everything online, but that's still available. So I think it allowed for more people to access treatment. I think what we see is there's a lot of disconnect socially with our different clientele. So I think the need for psychologists, psychiatrists in the mental health field is big. A lot more people willing to kind of go and seek it out. I think one frustration I do see, I don't like social media psychology. So I do get frustrated that a lot of clients that come in think they already know. I'm assuming, the doctors would also experience that. They come in telling you what your symptoms are, their symptoms are, and knowing whatever diagnosis they already have. I think that's frustrating. In this day and age that you can research or search up anything, there's a lot of like misinformation out there, and that can be frustrating. So a lot of work. So there's more opportunity, more places to go because of the use of technology, but then there's also like some misinformation that you got to clear up prior to then actually intervening and treating clients in the mental health profession. So it's kind of been the trends I've been seeing.
Yeah, guys, I would tell you, no matter what you pick, at any point in time, there are going to be a tremendous number of opportunities within that field, and there are also going to be a huge number of threats in that field. So, what's the good, bad, and ugly with medicine? Well, the good is that a tremendous amount of innovation comes out of the U.S. healthcare system. 7 of the last 10 most influential things that have happened, depending on who you believe, they've been developed in the U.S. healthcare system, and we truly are in a position to deliver healthcare wonderfully well. But here's the bad news. There's tremendous inequity in how the healthcare is delivered. It's tremendously inefficient. And for people who even have access to healthcare, all of you have insurance, whether it's through your parents or whether it's through the university, try actually accessing your healthcare. It's very difficult these days, and COVID has made it incredibly hard to do. Why? Well, the system is very inefficient. It hasn't caught up to all of the other technologic advances. And frankly, there's a shortage of doctors everywhere you look. And it's you guys that are going to make a difference when you go into medicine, or healthcare in general, because you're going to be able to deliver care to people who haven't had it. Even people who have insurance, we're under cared for as a society. And that's a tremendous opportunity. And the second thing that you guys are going to have the opportunity to do, whether that's being in psychology or mental health or delivering healthcare as a doctor or administrative healthcare, you're going to be able to help change the system. Because frankly, right now, it works for some people, but it doesn't work for everybody. And even for the people that it works for, it is really inefficient. So this is an exciting time to do what you're doing. And you need to figure out, you need to do it because you love it. Because there are some pressures that come with it. And if you don't love it, sometimes those pressures can overwhelm you.
I appreciate how you phrase it with such positivity, because I tend to sound much more negative when I answer that question on these types of panels. I will say that, there are a number of aspects about going into a career in medicine, specifically even a career in surgery, that have changed even since I was in medical school. And I think that there are always generational differences of how those entering into the medical field, what the philosophy of that generation may be. For instance, the concept of wellness, burnout. I mean, that really wasn't talked about when I was in medical school. And the expectation of working, your working hours and commitment, a lot has changed in a very short period of time. I do think that it is a very long road to get to this point, and there has to be, at the very basic, a love of what you do. And I can honestly say, even when I've worked somewhat illegal amounts of hours, at the end of the day, there's nothing I could imagine doing other than what I'm doing. I have the most exciting job in the world. I get to, heal people, sometimes physically with my hands. I get to make their quality of life better, sometimes cure cancer. There's nothing more rewarding, but it comes with a ton of other aspects of pressure, of the financial aspects of medicine and healthcare. the frustration for patients with lack of access to me or my team, the long wait times. Nobody really wants to work in healthcare. So we have a shortage of nurses and nurse practitioners and PAs and medical assistants, all the folks who go into delivering healthcare. It's not just the physicians. And that makes it really frustrating when I can't help people as fast or as much as I would want to. Then there's, of course, the lifestyle stuff. I inevitably get asked about being a woman in surgery. I have 2 kids. Nobody feels like they're allowed to ask me that. I guess it's not appropriate or something. I don't know. I think that, to me, balancing how to have a life, a relationship, a family is a whole other difficulty, whether you're the one bearing the child or not. It's not that, my male colleagues don't have the same or similar pressure. I am the only woman in my department, so there aren't any other women that share that same sense or ability to relate necessarily. But my gender has never played a role in whether or not I decided to pursue my career or what and that's just me personally. But I do know that can be a holdup for a lot of other women who are interested and are very worried about how they'll be treated and what the actual environment is to train in surgery as a woman. So I think that there are a lot of things evolving and changing, as they always do. At the very bare minimum, as I said, you have to love it. It's just not worth some of the really tough days, sacrificing of time with family and friends. And I mean, it's a lot of sacrifice if you don't actually really just absolutely love what you do.
Very good points. Thank you. We also have another alumni joining our panel. Chelsea, if you could introduce yourself for us and then kind of give us a little background about your day-to-day.
Sure, absolutely. Hi, all. Wildly sorry that I'm 30 minutes late. I had a conflict, but at least I'm here now. So I'll keep it super short. Wonderful to meet you all. I'm Chelsea Glenn. I'm the AVP of Business Strategy for Northwell Direct. Northwell Health is a very, very large health system in generally the New York Metro and beyond. And basically what I do is help design strategies for ways that Northwell can reach out to employers and partner with employers on their employee health and wellness and their employee benefit coverage. So for people who get health insurance through their employers, which is like over 50% of the US, with a way that we're like designing programs to help keep employees healthy and make sure that they have good access to healthcare once they are sick or need help. So that's what I do on a day-to-day basis. I worked first in finance, then in healthcare consulting, and then for like working with health systems, hospitals, providers. Then I worked for an insurance company called Oscar Health, which was very tech driven. And now I'm at Northwell Health, which is my first not-for-profit system. Very different. I tell you, as you think about like thinking about where you go in the job search and things like that, not-for-profit vibe versus Oscar Health as a publicly traded company, very different vibe and feel and set of priorities and incentives. And then consulting was super, super corporate environment, obviously, as well. So different mix if folks are interested in that kind of thing, of asking more. So anyway, that's all. Sandra, did I do good? Anything else?
Yes, if you want to answer our question that we had, we were talking about what were some of the trends that you see in your profession, whether related to the pandemic or not.
Ooh, okay. That's what folks are answering when I jumped on. Like echo everything I said, massive burnout problems. So access is gigantic problem, both from a supply perspective of physicians and nurses and nurse practitioners, all of that kind of stuff, as well as just to the point made earlier, like we haven't transitioned or figured out exactly how to like weave in technology and best use technology to expand access. So a lot of what I work on is trying to create innovative ways to bring primary care to people, bring screening and mammograms and colonoscopies, et cetera, and get people to be able to access care sooner. And then what other things? There's a lot. Inequity in healthcare was a really good theme that I heard brought up. Extraordinary levels of inequity in both accessing care, having coverage for care, finance of care. It's absolutely unsustainable, the financial system behind healthcare, working from an insurance side as well as from a provider side. It's ridiculous. I don't know what will happen, but do please remember, like, your entire healthcare financing system of insurance is a post-World War II construct. And so, like, it's not like, oh, this is how it's always been since our founding fathers and like it can't possibly change. And like we have the very best, like, absolutely not. We have an incredibly broken system of financing where every single person pays a different price. So if you're Medicare, if you're 65 up, you pay a price up by the federal government, which is a different price if you're on Medicaid, which means you're low income and qualify for state coverage. And you pay a different price if you work at Oscar Health versus Northwell Health versus any other company, Northwestern, et cetera. Literally everyone's paying a different price for the exact same service. And all of those prices are completely unsustainable. So very exciting. That's probably not like a positive like message, but a lot of opportunity to innovate because it's super broken.
Yes, thank you. A lot of good points brought up. Continuing on like the pandemic side of things, what are your organization's expectations, or how did they deal with the pandemic, and whether a difference can be seen whether you're working in the office or remotely?
So in the nonprofit world that I work for, it's a residential treatment facility for kids. So there was no like doing something remotely. Like we were in it all day, every day with our young people. I mean, there were times in the pandemic where it would be literally myself and one other person for an entire unit of kids. So in every place, we need workers, right? So as a person coming out of school, there's more than enough opportunities for you to get in there and have a place, whether in the mental health field, the medical field, like it's just need. It's need everywhere. I think, yeah, I guess I could just pause there. Like the needs there. What we see in, post-pandemic is just a lot of, I don't know, you guys maybe can help me understand this. Like people don't want to work. So like we need people to come in and do work and do hard work, particularly in the mental health field and particularly in the nonprofit, residential side of things. And so it, really challenging people to get outside their own stresses and be able to kind of give towards other people. And it's been pretty tough.
Yeah, I echo similar points of view. So I don't even know where to begin. But with the pandemic, I think, personally went through a lot with COVID, and then the healthcare system struggled a lot. So first things first, we shut down as an institution. So on one hand, half the doctors weren't doing anything because they couldn't deliver care, but the other half were in the ICU with all the nurses and all the respiratory therapists literally fighting for other people's lives while they were putting their own lives at risk. So there was a strange sort of dynamic going on, half the healthcare system completely shut down and the other half working as hard as they could, risking their lives. The second thing that was a real struggle at some point was, having to mask and then talk to patients. Very difficult when you're doing a job that requires empathy and the ability to connect and communicate, and you have to have a mask on. So very, very difficult to do that. And that we finished masking last May, I believe, if I'm not mistaken. So, it's been over a year, but not by a lot. And Haley, I might be wrong. It might be even after that. Maybe it was actually even this January that we finished masking. So I can't even remember, but it was a long time. And then the third thing we struggled with was we as a healthcare system, and you might agree or disagree, but we mandated that everybody have a vaccine, everybody who works at North Shore. And we were sued and we lost that case. But that was just another point of contention, depending on where you lie on the spectrum and what you believe. So there were a lot of struggles. Not to mention that when the doctors did go back to work, they were worried about getting sick. I got COVID, I think 3 days after we shut down. We were still doing emergency cases. and I was lucky enough to have a mild case, but that just confounded or compounded, I would say, my experience with it. But we're not. You guys all suffered as well. My daughter, who's a senior, was supposed to get dropped off on campus for New Student Week, or I don't know what they call it, and they pulled the plug on, students being on campus the Labor Day before we were supposed to move her in. And I don't think that class, they're now seniors, I don't think that class has ever recovered. I see a couple of, are there any 2024s on there? So that's her class, yeah. And so would you say that's true? You guys probably haven't completely recovered from that. And so, this was tough times for everybody. And I think it's changed our profession for good. But there's still lots of opportunities to do good and to make a difference. Thanks.
If you want, I'm happy to just let you guys go to the other questions. Those two answers were pretty phenomenal. So I would rather give people a chance to ask questions if you want.
Yes, if you guys don't mind, we can move on to some student questions. So I do have one for Dr. Spuri and Silver. If you could elaborate on your undergraduate pre-med experiences, in particular with clinical experience, shadowing, and volunteering.
Bill, you want to go first, maybe?
Sure, yeah. So I mentioned earlier I was a neuroscience major, and I did do research all 4 years, 2 years in one lab, 2 years in another, intentionally very different kinds of labs to give myself that exposure. I will say one big plug I have. I read applications. I did do some medical school application review, and I review every year and help recruit residents to our program and before at Northwestern. One plug I have is a few things. First of all, you guys are all smart. You made it this far, and so that's just a given. The two things that I would really just want to stress, one is think about some of the doctors you've ever interacted with. What made a doctor a good doctor or a bad doctor in your eyes at that time in your life? Hopefully not many of you have had too many health issues, but even just for routine healthcare. And most of the time, I would say, you would say that person was easy to talk to, could connect with that person. Something became relatable. Maybe you shared a common interest. The point is we are all humans too. And sometimes the success of us as physicians is really based on the rapport and relationship you can develop with your patient and how honest and forthcoming the patient is with you. You can't always make the diagnosis based on a blood test. And I think that these years of your life, you don't get back to just explore interests that you have outside of medicine or science. So, you want to be a well-rounded human. That is really important, no matter how focused you are on going to medical school. So that's one thing that I just want to say about, my summers during college. One summer I volunteered. There's a place here in Chicago called the Chicago Children's Advocacy Center. It is a wraparound center for kids and families who are affected by sexual abuse. It's been around for a long time. It's a part of a greater national network, but it was one of the first in the country. And it brings together DCFS, police, physicians, psychologists, social workers, all under one roof. So a child who has been a victim of sexual abuse doesn't have to tell their story over and over again to be re-traumatized. And it's an amazing center, sort of on the south side of the city. And so I spent a summer volunteering there. They didn't really have volunteers. I kind of asked them to create a position for me, but I really wanted to have an experience being exposed to a world that I wasn't very familiar with, other than understanding what it was like to be a kid with health issues. I absolutely loved the experience. It was out of the box a little bit, but it was still involved volunteerism and something sort of medical related. But other summers, I got a regular job. Maybe I did some other volunteer work, but it's, you don't have to have the perfect application or what you think is a perfect application. at the end of the day, I spend 8 to 12 hours in a room with no windows with people. I need to know that the people I'm around are people that I can enjoy conversation with and relate to, and I can teach, and who are human beings. So, you know, the applications that stand out to me, the personal statements that I read are the ones that come from real life experience, people who, you know, have out of the box or, you know, not cookie cutter applications. So that I don't know. I'm a little bit not traditional in that sense, where I don't believe you need to have exactly, you know, what you think is a perfect application. Really pursue things you love. That's what shines through. The people who force it because they think that's what we want to hear, we often can see right through that. So I would say, you know, if there's a subject matter you like or something you want to travel, you want to go visit another part of the world, working, you know, whatever, do that stuff, because that's, you know, life is precious in that way.
That was just an outstanding answer. I would echo. So full disclosure, I was an HPME, which, and that program at Northwestern is now gone. So I was a 7-year, which meant I spent 3 years on campus. And then I essentially had automatic acceptance into medical school. And everybody around me who didn't was angry and constantly, you know, throwing things at us. But so I actually, in some ways, regret not having, you know, a regular experience, because I don't think that I was as intellectually curious as I should have been. And so I concentrated on maybe some other things instead of being able to diversify my academic sort of interests or resume. And so I would echo two things that Haley said. Number one, really be intellectually curious. We toss that term around so much and it's so cliched, but there's something really to it. Explore things that you're interested in, and you know, don't always think about taking science classes. Take advantage of all the things that Northwestern has to offer you, because it will shine and show up on your application. Number one. Number two, I would say figure out your story in terms of how you're going to convince them that you're really interested in being a doctor, because it's tough sledding nowadays. It was back then. It's even tougher today. So, and that's going to be genuine, no matter what the story is. Make sure you hone that story. Make sure you understand how you want to tell that story, because all of you are going to have that story. But spend some time cultivating how you're going to tell that story, because that will be impactful. And I would echo what Dr. Silver said. You know, we're not looking for 4.0s. We're looking for people that are curious about what they do. Sure, they need to be able to handle the content of what's being done, but all of you can handle that. And then it's really who wants to be there, who wants to be there bad enough. To me, those are the most important things. Grades are important. I wish they weren't, but it's clearly not the only thing that's being looked at. In fact, even more so today than ever.
Thank you guys for those answers. I have one question that I got for Anthony Ward. What other experiences besides therapeutic day school were useful for your career?
Sure. So I've done therapeutic day school. I've been at a psychiatric hospital on the adolescence wing, group homes, and then private practice. I think that's about it. So I think there's so many things in the mental health field that you can do and be a part of. I think similar to what the doctors were saying, is like you got a broad category, and then you show up and there's like this little sliver that fits who you are, and you can kind of plug in and be there more completely, and you can give more specialization for yourself to that particular place. So yeah, that's what I've been through. Yeah, I think that's good enough answer.
Awesome, thank you. Does anybody else have any other questions? I think we maybe have time for one more.
I did have a question, very quick one. I was asked if any of you practice medicine in a different language, and how has that been in your career?
I have not. The only experience I have is spending, those weeks abroad and having been fortunate enough to have translators. But that barrier can be real and can be significant. And if there are ways to break down some of those barriers, I think everybody wins. But no other experiences. Thank you.
Yeah, I don't have other than the fact that I'm African American, I think we have a certain way of speaking, and I think that sometimes dialect is also needed. So even if it's not a full new language, like if you don't have to over explain yourself as a client or a patient, I think it helps them really connect to who you are, that humanity side of things. Yeah, so we have people who are bilingual or multilingual is helpful. And if we just have people who are from multiple contexts and they're, who they are, that allows people to not feel like they're the other right in the room, right? So they come to you wanting to feel better, wanting to, know more. And if you look so far different from them, if you don't, have an understanding of their own context, I think it makes it hard. So having as many people with many languages who look so different helps people feel like they want to access and stay within the treatment they're being given.
Thank you. I have another quick question for you, Anthony. Someone was asking if you have any advice for students that are psychology majors but don't want to go the medical route, and what advice you have for maybe finding jobs after undergrad.
Sure thing. Yeah, so I didn't finish my pre-med, so I got all the way up to biology, and I was like, I'm done. So I think one, do a lot of things that they're talking about, like volunteer in different places. Do internships. I think what you'll do is you'll find something that kind of fits you, and then you kind of go into that. Ask around. So ask a lot of people information. So my first job at a therapeutic day school came from my cousin's wife. So I think, we always talk about networking, but if you have questions and ideas and things that you want to know, ask a lot of people stuff, and people be like, you know what, I know this one person that knows this one thing who has this one place, and then you'll end up, going there to work. So yeah, I would just say do that. I would say, look up online, your Indeed stuff, things like that. In psychology, what you can do with a BA in psychology or neuroscience or things of that nature. And there's a whole lot of things. I think the autism spectrum, like there's a lot of stuff that you can do as a ABA therapist, and you would only need to have a bachelor's degree to do that. Yeah, I think working in certain nursing homes, you can also do that with a BA in psychology, in the psych ward of certain hospitals. You can also do things with your bachelor in psychology.
Thank you so much. I think we have about 20 seconds before we head back to the main room, but everybody please join me in thanking our awesome speakers today and for their time. Thank you guys so much. And yeah, good luck everybody with the rest of your sessions this afternoon.